As said by the introductory speaker, my job here is to give you a quick overview of something known as salt triaging. So we all know what exactly is meant by triaging. So for the sake of audience, I can just define. It's basically depending upon the severity of patient that is presenting you in case of a mass casualty. So mass casualty means you have a disaster. It can happen outside your hospital. You need to go to the field and see the patient there, or else a n number of patients are coming to your hospital following a disaster. Maybe, for example, nearby you have a blast and you are going to get like 20 to 30 patients together, and they are going to come to your emergency room. So depending upon the severity, we'll be triaging some. So that is a simpler term, prioritizing patients depending upon their disease severity. So that is what is all about triaging. So my job is to describe you something called as a salt triaging system. So when you come to triaging system, there has been a lot of name triaging system to start off with something like a start, jump start and all, which was there in 1983. So 2008, there is a new triaging system recommended by National Association of Emergency Physicians in US and CDC. They came up with something called as a very simple tool which will help the patients to be triaged in a quick way. So the advantages what they felt with this salt triaging. So that is one important thing. It covers all the ages and population. It is simple and easy to remember, and it identification of patients' needs depending upon whether it is life-saving intervention, anything is needed or not, can be easily understood. And there is no requiring to count the vitals or timing of vitals, like calculating a respiratory rate, all those things has been avoided in this. And there is no diagnostic equipment requiring, and all patients having an individual assessment regardless of global sorting results. So even if everyone will be sorted out separately with very ease. So that is what is basically the salt triaging. It's a simple triage and rapid treatment. So that is in simpler terms. It is a standardized system and used in emergency medicine to quickly assess and prioritize patient during mass casualty incidents or disaster. As I told, it is very efficiently allocating resources is very key in case of a disaster. So such a disaster triaging tool will help you to use your resources judiciously, and also very important to provide life-saving intervention to those at critical needs. So that is what is salt triaging. So this is a simple algorithm what you can go through here. You need to sort, that is S for sort. You assess the patient. You see whether there is any life-saving intervention is required or not, triage and treat them. So that is a simple algorithm. So the step one, what you need to do is the global sorting out of the patient. The patient is able to walk. For example, you have like 30 patients. You can just ask them, whoever is fit, whoever is okay, you can just move to the right side, or you can say some area specific near to a building or some landmark. You can ask them to move. So out of 30, maybe some 15, 20 will be able to walk. So you're just segregating them and you're keeping them to an nearby area where they will be assessed on later. Then the next simple question, what you can ask, who are able to wave or do some purposeful movement, or you can just ask them to raise their hand. So for example, you have 15 out of 30, you have 15 sorted out, then you have only have 15, which we need to find out whom we need to start assessing them first. So that is a second group of patient who is just able to raise that we need to assess. And the most important ones are those are unable to do either wave their hand or rise up your hand, or they are unable to move. These are the group of patients who are unresponsive, those require rapid treatment. So that is the first group of patients that we should be assessing. So that is the most life-threatening injury. And step two is to assess the individual one. So you need to see each patient. Now, out of 15, maybe after second assessment, you would have sorted some 7 to 8. Then you have another 7 patients. So that 7 patients, you need to start them individually. And most important things, you need to do some life-saving interventions like control of major hemorrhage. You need to open the airway, doing a chest decompression, and then auto-injector antidote, for example, if it's an anaphylaxis. So there are a lot of life-saving interventions. Some of them only I have mentioned in this flow chart. And next important thing, you need to look for the breathing. The breathing is, yes, the patient is able to obey commands or make some purposeful movements, has peripheral pulse, not in respiratory distress, or major hemorrhage is controlled, then yes, there is no major injury. You can keep him under either a green category or a yellow category. But if there is a major hemorrhage, it is not controlled. There is no pulse that is palpable. There is no peripheral pulse that is not there, and the patient is not having any purposeful movement. Then you need to understand that you need to act immediately. But usually, in case of an disaster, what we need to understand is that we need to utilize our resources judiciously. There will be a group of patients that we what we call as non-salvageable group of patients, where whatever you do, he is not going to come out of it. So it might be an run over by a trolley, or it may be a complete amputation or something where you are very sure that we whatever be the resources we are going to utilize on him, it is going to be futile. So that is the expectant group, where we can put it as gray or blue depending upon your system. They are not going to survive. So don't waste your resources. I might feel a little bit blunt on it, but that is the most important thing that you need to keep in your mind. So that is what SALT algorithm. SALT, patients are categorized into 4 groups based on their severity, and vital signs are evaluated. That is the assessment. And again, evaluate vital signs, most importantly, breathing, pulse, and consciousness. And injury assessment, examine the patient for injury, including bleeding, fracture, and burns, to determine the severity of their condition and treat. So this was the initial one, that is a start. You see, it is very much complicated, which was there in 1983. From this, we have come to a very simple algorithm. So that is what is SALT triaging system, or SALT. We just say SALT, that T stands for the triaging system also. So when you see the simple triage and rapid treatment, that was the start. It is a little bit complicated, but almost the concept is the same, but it is a little bit complicated. But when you see SALT, it is very easy. So that is the difference between your SALT and your the previous one, like called as start. So benefit, as I told, efficiency, optimize resource allocation by prioritizing patient, standardization, ensure consistent patient care and reduce error. And you need to understand that you need to have a continuous assessment. Not one time triaging is not enough. You need to have an ongoing reassessment has to happen. So once you have done a triaging, a yellow category can become red, or a green category can become red, or a red category can be down triage also. So you have to sometimes up triage and down triage. Both these things are very important. So you need to understand that it's the first process only, but later on you need to rapidly. Don't think that after your triaging everything is over. You have given treatment, but again, you need to retriage this group of patients. And very important, you should have an effective communication and coordination among healthcare providers are very, very crucial. So the second session, what I have been allotted is what are the major programs that is available in India. So I think we are going to have an expert opinion by Dr. Tausif regarding various program also in the coming session. So I'll just give you an overview. So the most important agency what take care of the disaster management in our country is the NDMA, National Disaster Management Authority. It coordinates all the disaster management efforts, and there is state level, that is the state disaster management authority, and in every district, you, being the collector as the head of the district disaster management authority, you will have hand which can be managed at the district level. So this is the structure what is being there presently in India. So briefly about NDMA, we have something called as Disaster Management Act, which came up in 2005, and the NDMA office, everything started as per the Act in 2006. So that is the birth of NDMA, that is the National Disaster Management Authority. So its purpose is to lay down the policy, plan and guidelines for disaster management, policy, plan and mitigation, operations, communications, information and technology, administration and finance. So these are the key aspects of our NDMA. So they have got many programs. Among this, one program that I thought I can highlight is National Cyclone Risk Mitigation Project. So what have they done? They have made four components to it. So component A is an early warning disseminating system. So we know that a cyclone is going to happen. So they are going to create one. So the present process, they have completed component A and B. So component C and D is going on. So it is something like a 400 crores projects. So that is what they are doing right now. And component B, you can see cyclone risk mitigation infrastructure. That is what they are developing. And there are component C and component D is yet to develop. So this is just one program what they are doing. I just wanted to do how structurally they are doing these things, just to show that I have taken this. So there are other group forces also, something like National Disaster Response Force, that is called as NDRF. Then there is Indian Coast Guard. Then there is Indian Air Force. This all help us during disaster. So major idea why these government agencies are there is basically to disaster risk reduction, measures like hazard mapping, early warning systems, and communication, community preparedness, and disaster response and relief. In case a disaster occurs, you know all regarding the Wayanad tragedy, how the government, both the state and the central government, have with the help of a lot of NGOs and lot each one of us who was present there, how they have done for the Wayanad a recent flood, and rapid response mechanism, rescue teams, and relief material distribution. That is the next part. And most important, disaster recovery and rehabilitation, which is still going on in Wayanad because of the disaster. So, post disaster effort to rebuild the infrastructure, restore the livelihood, and provide rehabilitation service. So, this is the programs which all will come under NDMA, but state government has got its own projects, and there will be separate project. It will be mixed together. But the major group that is doing this is NDMA, and we have got a state and as well as a district group. So for understanding more Government of India initiative programs, you can go to this website for further updates. And with that, I think I have been on time with 15 minutes.
Yes, sir.
Yeah.
Thank you.
Thank
Thank
you.
you, sir, for such a wonderful session.